Hi, my name is Essie Merkerson. You may know me from my work on television, Law and Order, and now Chicago Med. And if you're a theater buff, some of my theater work as well. But about 5 or 6 years ago, I began to slowly feel lower back pain until it got to the point where it was very difficult for me to work. And, you know, with the kind of work that I do, we're on our feet, and I could work anywhere from 10 to 12 and sometimes 14-hour days, depending on where our location is. And so I sought out a physician, and I had what was a less invasive surgery than what was needed. And I ended up right back in the same boat, unable to function at work. So I needed to find a doctor, a physician, a surgeon who could help me get over this pain. I was unable to sleep at nights. I couldn't turn in the bed. If I walked the streets and stepped on a curb down from a curb, I would get this excruciating shock of pain up my back. It had to stop. So I spoke to my general practitioner and asked if she could recommend a doctor that I could talk to, because lower back surgery is not something that you think of or take lightly. So she recommended Dr. McCance. And I went to see him, and I have to tell you, when I walked into the office, the first thing I noticed were the high chairs. So I didn't have to worry about how am I going to get up and out of this chair. That was the first consideration that I acknowledged. But then I had an amazing conversation with Dr. McCance about what was happening to me and why it was happening, looking at x-rays. And I was convinced that this is what I needed to do. And so we set about scheduling my spinal fusion surgery. And that was, I want to say, 2018. I mean, I'm almost forgetting the date because I've been pretty much out of pain, you know, since then. And whenever I do, my back does feel cranky, it's because I've been standing on my feet in high heels all day. But I have to thank Dr. McCance for bringing me into the surgery with the feeling that I was in safe hands, that I would have a different outcome than the first surgery. And I feel so much better. And I just wanted to say, you know, if you're feeling this way, if you're having this pain, the best thing to do is to speak to a surgeon regarding what can be done. And Dr. McCance did that for me. Thank you, Dr. McCance.